a privilege to be here today, and I'm excited to share some information with you. I love what I do for work. I get the opportunity to educate families on a day-to-day basis on what the aging process looks like, how to pay for it, how to deal with cognitive impairment, changing needs, what options are available to them. So I love what I do, and I'm excited to share some information with you. I'm going to also post my contact information at the very end. So I'm going to get through a lot of information, hopefully touch some highlights and some key points for you guys. But if you have any questions or need any further information, don't hesitate to reach out or pop over to the little chat section. I'll be glad to try to address some of your questions. So what my intentions are today is just to educate you a little bit about what aging looks like, what to expect, how to pay for it. Yes, I work for the Wellmore of Lexington. We're a senior living community here in Lexington, South Carolina, and we are a continuing care retirement community, which I'll explain a little bit about what that is. And I was the first employee here, so I've had an opportunity to see this be built from the ground up. So this has been a wonderful experience. I've met every single member that has moved into our community, every family member and every employee. So I'm truly blessed in what I do each and every single day. But I'm going to share my screen with you guys. Remember, I'm an expert in senior living, not PowerPoint presentations. So let's see if I can get this over to y'all. All right. So a couple of things we're going to talk about are the current state of the industry. As you know, COVID has affected us in lots of different ways. So I'm going to give you kind of a brief update as to what we're working with right now. Some aging options, what that looks like, whether that be staying at home, living with an adult child, or moving to a senior living community. Some differences between Medicare and Medicaid, easily confused, and I'm going to tell you kind of an easy way to separate the two and what they cover and how much they cost. What different levels of care are available in regards to independent living, assisted living, memory care, and skilled nursing. And then how much this costs and some resources that are available to you guys that you may not know about, specifically the VA aid and attendance program. So definitely some good information there, and then some other resources that are available to you. All right, let's see. Presentation. Okay. All right. So currently, the governor has restricted all visitors here in nursing homes. So we have had quite the challenge of being able to stay connected with our members and their families through FaceTime, through window visits. Our regulations are not currently allowing us to have any outside visitation at home, outside of our community. The governor is speaking today at 2 o'clock, so we're hoping that some of those restrictions will be lifted. We're very excited to hear what he has to say, to find a way for us to safely connect our members back with their family members again. The power of human touch is pretty powerful. So people are living longer, healthier lifestyles. I mean, it's just the truth of the matter. People are living to be older than their parents were. Yes, we have more health concerns, but with access to medical care, physicians' offices, people are living longer, healthier lifestyles. Prior to COVID, the market was getting flooded with senior living communities. There were options popping up everywhere, specifically in the Greenville and the Charleston market. People are living longer from 1958 to from 1959 to 2016. The average age of someone living was 69, and then increased by almost 10 years in 2016 to 78.9. So people are living longer, and you'll see that there's some options out there for maintaining that healthy lifestyle. Some statistics of COVID in senior living communities, it is kind of scary, but there have been a total of 156 communities that have reported cases here in South Carolina. So a lot of this information that I am going to share with you is just for South Carolina, but if you would like some statistics for some other states, I'll be happy to pull that information for you as well. There have been 1,500 reported cases amongst residents, 803 employee cases, 291 resident deaths in communities, and 2 employee deaths in communities related to COVID. So it has hit us pretty hard. I think this all started for us back in middle of March is when we went on full lockdown. And some communities are still requiring their members to stay in their apartments, to eat in their apartments. They're unable to come out and do any kind of communal dining. or any communal activities. So it's been really frustrating. We've been really creative, and I'm sure you've seen some really awesome Facebook posts or some social media posts of people doing some window visits and celebrating birthdays in creative and different ways. So it's been challenging, but we're excited to hear what the governor has to say today. So when we talk about aging options, there's really three choices. If you have a loved one in your family who is getting a little bit older, you're starting to see some decline, some complications, you basically have three options. Stay at home and introduce home care, hire in somebody to come help. You can fix up the house to make it a little bit more accessible. There are things that you can do to continue staying at home. Now, there's some pros and cons to that. Remodeling the house, social isolation, who's going to go get my groceries, who's going to take me to the doctor's office. So there's some codependence that would need to happen in order for somebody to stay at home. So these are just things to think about as you're kind of walking through options of what that next step looks like. And I know I talk about, your aging family members, but it's important for you to think about this stuff for yourself as well. You'll see a common theme of what I talk about is start having these conversations early and often, and kind of demystify what aging looks like. We're all dying, just at different rates. So it's important that you do talk about it and you have these conversations early so that your family can respect your wishes. So if you wish to live with an adult child at their home, I would certainly recommend that you ask their permission first, and before you start, packing up your stuff and go knocking on their front door. But there are some benefits to that. The socialization aspect, the intergenerational aspect. You've got resources available to you. You may still have to hire in some help to help with some of those activities of daily living or those day-to-day showering or medication management or nursing needs. But it does create a family atmosphere. And for some people that works for them. Other option would be to move to a senior living community, and there are tons of them out there. So I would encourage you to go out and take a look at communities before you actually need one. I know some of my favorite tours that I give now are just people who are looking for the future and wanted to come see, touch, and feel what communities have to offer. You don't know what's out there until you get out there and look, but senior living communities come in all different shapes, sizes, and colors. There's different levels of care, which I'll kind of go over a little bit for you. There's some standalone options, some full continuum care options. So definitely some good resources out there. So again, have these conversations early so that you're not stuck with option 1, 2, or 3 based off of what your family thinks that you want to do. So I talked a little bit about levels of care, and I'll go kind of from the most independent to the most highest, or the highest level of care through this kind of flow chart. Independent living can come in a standalone community. It can be a large, what you think of as Sun City in Florida, a 55+ community with lots of little houses and lots of little activities, and usually some really great amenities and great dining options. Some even have golf courses, multiple swimming pools. There can be some really great benefits that come with independent living. Some of them are going to be buy-in communities, and we'll talk a little bit more about continuing care retirement communities at the end. But when you're looking for independent living, it's really just a downsize option of where you are now. So it functions like a single family home or a single family apartment, and usually you don't have any kind of care provided in that home setting. So you can hire in people to come in and help you, and a lot of people choose to do that, but there is a cost associated with that as well. So keep that in mind as you're looking through options. It is a maintenance-free lifestyle. Typically housekeeping and your light bulbs will be changed, your refrigerators will be cleaned out. Some places will even do your sheets and linens for you. So it's important to ask some of those questions and what the benefits are with those amenities. So beyond that, when somebody moves out of an independent living option or needs a higher level of care, that next option for them is typically assisted living. And what that looks like is, again, there are some standalone communities, there are full continuum communities. Assisted living is a licensure. So we are governed by DHEC, and our licensure is 6184. It can be found online, and I'm going to show you a little bit more about that later. Assisted living is a social environment. I could go open up my own assisted living by myself, and I don't have to hire a nurse. The only person that I have to have on my staff would be an activities director. So it seems kind of crazy. This is just for the state of South Carolina again, but you do not have to have a nurse in assisted living, and some communities choose not to. We here at Wellmore have multiple nurses here in that level of care, but that's something that you want to be mindful of as you're going to look at some communities, that there's no requirement to have a nurse or any kind of medical component. That means that the people who are passing the medications are medication technicians, sometimes not even certified nursing assistants. So it's important to ask those questions and learn about their credentials before making some decisions. There's no stove or oven in assisted living, so the idea is that they're able to come down and do some communal dining. So that's one thing that our regulations does not allow, is any kind of hot plates or hot coils. And yes, that does mean your toaster oven, and yes, people do try to sneak it in. So we can accommodate irons if they have a automatic shut off, which sounds kind of crazy, but some of these people like to iron their clothes. The way that you pay for assisted living is either through private pay funds, meaning what you have in your savings account or your Social Security every month, or your pension or your retirement, or there is a Medicaid option for assisted living. And here in South Carolina, it's called OSS, and the beds are hard to come by. There are not very many options here. I would encourage calling around before you start looking for a Medicaid bed for assisted living, because there just really aren't great options. We're looking on kind of expanding the Medicaid program here in South Carolina, but there have to be some funds available for that. I know here at Wellmore, we opted not to have a Medicaid contract. We couldn't get one really if we tried. And the communities that do have them in place, they're only allotted a certain number of days per bed. So something to just kind of keep in mind as well. So beyond assisted living is what we call memory care. Typically, they are going to be secured units, meaning that they're locked both going in and going out, because typically someone who lives in a memory care unit has some sort of cognitive impairment. It is licensed as assisted living, so it does fall under the assisted living umbrella. So again, does not require the care of a nurse, but most places do have some sort of nursing component in place for memory care. It allows a safe space for people to wander. It gives a clear line of sight down each hallways, great common space for social interaction. Memory care, if done right, can really bring a lot of joy to a lot of people. I know here at Wellmore, we do a Montessori-based programming here in our memory care, which is a lot of hands-on, a lot of interactive, see, touch, and smell. We have a multi-sensory room. So all of those things would be something that would be beneficial for somebody in a memory care type community. Beyond memory care is a different licensure called skilled nursing. And if you can think of the traditional nursing home type place that you see in movies, of the white walls and the bright lights and smells like urine, those are really come and gone. Skilled nursing has evolved a lot recently. It still has a lot of evolving to do. It's a level of care that for individuals who require 24-hour a day, 7-day a week nursing care. That could be wound management, that could be IV medications, a trach, a peg tubes, any kind of external tubing or drains out of the body, something that requires the care of a nurse 24 hours a day, 7 days a week. So if you think of traditional nursing home type folks, maybe ones that are completely bedbound or not able to feed themselves, those might fall in that skilled nursing category. And I'm going to show you a way of determining between assisted living and skilled nursing in a different slide. So beyond that is inpatient rehabilitation, which is another component of skilled nursing care. So if you've ever known somebody who's gone to the hospital who has had a heart attack or a stroke or needs a new knee or a new hip, they typically get transferred to a skilled nursing community afterwards to get some continued inpatient rehabilitation. Medicare covers the cost of their stay in that community, but it's only for a short period of time. So Medicare covers days 1 through 20 at 100%, and this is going to be traditional Medicare, not Medicare replacement policies. 1 through 20 at 100%, and then days 21 through 100, Medicare covers 80% of the bill, and typically, if you have a secondary insurance, it will cover the co-insurance that Medicare does not pay. But again, after those 100 days, you've got to figure out what's going to be next for you. If that's going back home with some assistance, or returning to your prior level of function, or even making a move to a senior living community, or moving in with your children. You're only allowed to be in that inpatient rehabilitation for up to 100 days. You do have to have a 60-day wellness period in order to get those 100 days back again. So if you are in a rehab community and you do discharge home or assisted living or wherever, you have to have 60 days worth of no inpatient hospitalizations in order for you to recoup your 100 days. So once you use them for the year, if they're not gone, you just have to be well for 60 days in order to be able to get those back again. During this whole COVID crisis, Medicare has waived the 3-night qualifying stay for inpatient rehabilitation. Typically, when somebody's in the hospital, they have to stay in the hospital for 3 midnights. They have to be admitted, not under an observation status, for 3 midnights in order to transition to a skilled nursing community inpatient rehab. Medicare has waived that currently because we wanted to free up some beds in the hospital. So they tried to get people over to skilled nursing facilities quickly so that we could make room in the hospitals for any kind of COVID patients coming in. This has been really beneficial for us here, and I'm sure for a lot of other places as well. That means if you have a loved one at home that is experiencing a decline and you really feel like they could benefit from some inpatient physical therapy, you can admit straight into a skilled nursing community without going to the hospital. There are some qualifications. We have to make sure that we can put them in a proper RUG category and bill Medicare for it and all that good stuff, but it is possible, and we have used that, and it's helped a lot of families along the way. So definitely keep that in mind. Hospice care. The common misconception about hospice care is that it's a place, not a service. But that's not the case. So hospice is a service that can be provided in any kind of place. So I have people on hospice services in assisted living, in memory care, and skilled nursing. People are on hospice services at home. You're actually able to graduate from hospice if you no longer meet that criteria. And typically for somebody to be admitted on hospice services, you have to have a diagnosis that means that you could be terminal within the next 6 months. Now, this is only going to be determined by their primary care physician or oncologist or any of their specialists that they're seeing. It's a conversation that you need to have. Hospice is not the scary term that it used to be before. It truly is an interdisciplinary team of professionals who address the physical, psychosocial, and spiritual distress, focusing on not only the dying patient, but the family as well. So you'll have a social worker that's involved, a CNA that's going to be coming out to provide some extra supportive care, and a nurse that can answer your questions at any given time. So it definitely is a great resource. It is paid for by Medicare. So it is absolutely free to use. You know, people get scared of that hospice word, but to me, it's an extra set of hands. It's an extra set of eyes of people who are caring for somebody. Now, it is a difference between therapy services, which is also paid for by Medicare, and hospice services. You cannot be on both at the same time. When you go to an inpatient rehabilitation and you're wanting therapy services, your goal is to get better. When you are on hospice services, your goal is to stay comfortable. They may actually discontinue some of your medications. They may introduce some pain medicine to help you be comfortable, but that's their goal through this palliative process, is to make sure that they're meeting your needs and your family's needs as well. So don't be scared of the hospice word. It truly is a great benefit. It does cover the cost of some of the medications that are related to your diagnosis. It can also pay for some equipment related to your diagnosis and some supplies. So like, for example, if I have COPD, I may need oxygen in a hospital bed and some nebulizer treatments. Those things are most likely going to be covered by my hospice service. So it's can save you some money along the way as well. And definitely helpful when you're continuing to stay at home and you've got family members who are coming in to help you. Having a hospital bed in a downstairs area so you're not having to climb upstairs can be definitely beneficial. Respite care is a kind of a category of its own. Respite care can be done in all sorts of different levels of care. Most of the time we see it in assisted living, memory care, and skilled nursing. And respite care is just for people who need temporary relief for caregivers at home. So if I care for a loved one at my home, but I'm getting ready to take a vacation, I can place my loved one in respite care at a community, and I pay by the day, and that person is going to receive the same care that they would receive if they were in traditional assisted living, memory care, or skilled nursing. So it's a temporary option for family members who do need a little bit of relief and a little bit of a break. In South Carolina, we have to process respite admissions just like we would a regular assisted living or memory care admission. So most communities are going to require a minimum number of days that you be there. Here at Wellmore, it's 14 days. And that just gives us an opportunity to get to know them, to care for them, to get them situated and adjusted. So be aware of that if you're looking for respite care services. A lot of places do have a minimum. Hospice also does provide some respite care within their benefit cycles. It's something that hospice paid for, and it does have to be done in a skilled nursing community, and there's some contracts that have to be in place. But it's definitely beneficial, and it's, again, free, paid for by Medicare. So I know I've kind of alluded to the continuing care retirement communities a little bit, but just like Wellmore here in Lexington, we are a CCRC, and or some may consider us a life plan community. And basically what that means is that we offer independent living, assisted living, memory care, and skilled nursing, plus all of those other things, all on one campus. So the idea is that you're able to move in an independent level of care, progress to a higher level of care if you were to need it, and not ever have to move outside of our community again. Some CCRC communities are buy-ins, meaning that you are going to have to put down a certain amount of money up front. Can be anywhere from $50,000 to upwards of $900,000, depending on what kind of property you're looking at. You do sign a contract, and there is a percentage of that you will get back once you move out or once you do pass away. So some people look at this as a real estate investment or a way to just kind of tie up their funds so that they know if I sign a 90% contract at $600,000, that once I pass away or I move out, my family is going to be able to recoup some of that money again. You do still pay on a monthly basis on communities like that, but typically the higher end, the $900,000 plus end, are going to be big, beautiful communities, usually coastal locations that offer penthouse apartments, large living spaces, and things like that. So I know I kind of briefly touched on memory care, and I hope I'll have a couple of questions about this because this is where I'm most passionate about. So dementia is an umbrella term for memory loss and other abilities severe enough to interfere with daily life. So we call it cognitive impairment here on our campus, but it breaks it down. There are over 400 types of dementia. Alzheimer's is the most popular at 60 to 80% of all dementias, and the one that you hear mostly about. More than 5.8 million Americans, 65 plus, are living with Alzheimer's disease. That's an estimated of 1 in 10 people over the age of 65 that have Alzheimer's. Like I mentioned, there's 400 different types. These are some of the popular ones: the Lewy body vascular dementia, frontal temporal lobe dementia, which can typically manifest some behaviors, some aggressive behaviors. What's important to know about dementia and this disease process is it's truly a brain-eating disease. There's some really great pictures of PET scans on the internet that show the holes that the brain actually does have once somebody starts progressing with dementia. It's a terrible disease process. There's nothing that we can do to slow it, nothing we can do to stop it. There are some medications out there that will help with some of your behaviors, some anxiety that comes along with it, some appetite stimulating things. But it's a tough disease process. To watch somebody slowly slip away from you but still physically be there is very challenging for a lot of families. The Alzheimer's Association offers a lot of group support, a lot of resources, a lot of knowledge, statistics on how to deal with this disease, what to look for. You'll see over here it's the 7 stages of dementia, and there's 7 stages of decline. Kind of broken down into 4 different levels: the no dementia, early stage, mid stage, and late stage. And this is typically determined by a test. Usually a neurologist will actually perform some sort of test. And if you ever want to test your family members, some of the questions that they'll ask are going to be to draw a clock. So, and they're looking for seeing where they place the numbers on the circle, or count backwards from 100 by 2, now by 5, now by 7s. So some people are actually pretty tricky and are able to memorize some of these answers. They'll surprise you every once in a while, but it's definitely something fun to kind of joke around with your family and practice. They typically say that anybody over the age of 65 lives in somewhere of stage 1, stage 2 of dementia if they haven't already progressed. So definitely keep that in mind. I usually ask families the question of when I'm doing my initial discovery of, do you feel like mom's mind is better than her body, or her body is better than her mind? And that really gets people to start thinking about which level of care is going to be most appropriate for them. When they say their mind is better than their body, you know, maybe we might be looking at assisted living, or maybe even skilled nursing care, depending on what their decline looks like in their body. When they say their body is better than their mind, we might be looking at a memory care type situation. But there is no cookie cut answer for this process. Everybody's decline is different. Everybody's wants and desires are different. I also ask about expectations when I'm doing my discovery process. If I've got a couple, especially together, you know, is it your goal and desire to have mom and dad in the same place forever and ever? Amen. If that's the case, we'll do our very best to accommodate that. So talk with your family and learn what their desires are and what their wishes are, so that if and when this time does come, you're able to make some educated decisions for yourself. All right. Assisted living qualifications. This is coming straight from our DHEC regulations. And I know this is a lot of information to get through. I bolded some of the things that I feel like are important and the things that I see most often. So when asked if somebody qualifies for assisted living or skilled nursing care, I immediately will refer to this sheet. If you have one of the 14 things listed, that could mean that you need skilled nursing care. Now, it's not an end-all be-all. The way that these regulations are written can be interpreted a lot of different ways. Some of the things that I see most often are sliding scale insulin. If you or a family member is diabetic and you are struggling with your insulin and have to take your blood sugars multiple times a day, then and then you determine your insulin dosage based on that, then it will disqualify you from assisted living in South Carolina unless you're able to manage all of those things yourself. Again, assisted living, we're not required to have a nurse, so those med techs are not able to make those judgment calls. Treatment of any kind of wounds or widespread disorders. Wounds are staged from 1 to 4, and there's different types of wounds and different ways to kind of treat them and to get rid of them. But if you have any kind of wound that needs daily dressing changes or attention from a nurse, then that may disqualify you from assisted living. This is the one that gets a lot of people. It's dependency and activities of daily living for more than 14 consecutive days. And it gives you some examples of bedridden, incapable of locomotion, unable to transfer, totally incontinent, and needs all assistance with their ADLs. Where we get kind of caught up sometimes is this incapable of locomotion, where you might think of that as they have to be able to get up and walk around themselves to be in assisted living. That's not necessarily the case. If they are able to sit in their wheelchair and use their feet to pedal or use their hands to kind of get them out and about, then here at our community, that is a qualification for assisted living. So the DHEC regulations are going to be your baseline, and then each community is going to have their own regulations. Some communities, if you're not fully continent, you're not able to live in their assisted living type setting. So just questions to ask along this journey. I also get asked a lot about the difference between Medicare and Medicaid. And it took me a while to kind of grasp what the differences were, but they are very, very different. When you're talking about Medicare, it is an insurance plan for people who are 65 or older. Or if you have been disabled or if you have renal failure, you could qualify for Medicare earlier than 65. It's a federally funded program, so it's going to look the same across all of the states. And it's broken up into four different sections. So you've got A, B, C, and D. So A is going to cover your inpatient hospitalizations and your inpatient skilled nursing stays. So anything that happens at an acute or post-acute setting is going to be covered by your Medicare Part A. Your Part B is going to cover your outpatient, your doctor's visits. You do pay for this portion of your Medicare benefit. And when you hear of people who have maybe had a small surgery and they're going to outpatient therapy, they're typically billing their Medicare Part B. Sometimes there's co-insurance involved with those things, but each doctor's office is different. So questions you'll want to ask ahead of time. Medicare Part C is a little newer to the market, and it is Medicare replacement policies. If you've ever seen commercials for Humana or Care Improvement Plus, or there's some Blue Cross Blue Shield Medigap policies, these are insurance salesmen that have come to you and are going to trade your traditional Medicare for this private insurance replacement policy. And they are great for a lot of things. I know, for example, Humana doesn't have any copays for your prescriptions. So if you're somebody who's on a lot of medications, that may be a good plan for you. But what they don't tell you is that Humana is not great in skilled nursing care, and you have to have pre-authorizations and qualifications in order to continue your rehab stay. So start asking those questions. If you're looking into a Medicare replacement policy, you can always switch back to traditional Medicare at any point in time in the month. You can just call, I think it's 1-800-Medicare, and they can get you switched back, but it's not going to be effective until the first of the month. So you don't have to wait for open enrollment to be able to do that. Part D is your prescription plan. You do also pay for that as well. Most people do have some sort of Part D plan in place. You don't have to get it through Medicare. You can get it through your supplemental insurance. It just kind of depends. So weigh out the costs and options with that. Medicare usually pairs with a supplemental insurance or Medicaid. So you can have Medicare primary and Medicaid secondary. And we do see that a lot coming out of the hospitals as well. So switching gears over to Medicaid. Medicaid is a state-specific program, and they get funds from the federal government and from the local level as well. Here in South Carolina, it's called South Carolina Healthy Connections. They have a great resource and website that you can go on and find out all sorts of information. There are many, many types of Medicaid here in South Carolina. There's stuff for children, there's stuff for adults, for long-term care, for just doctor's appointments and visits. So there are many types, and it is free healthcare to you guys. You do have to qualify in order to get Medicaid, and it is typically need-based and income-based. There's the application's online. You can complete it all online. There's some great people that you can call, and if you have any questions, they can talk you through that process. Medicaid does have a 5-year look-back period. So if you are thinking that you or a loved one may run out of funds, or your little nest egg of savings may run out at some point in time, it's important for you to have these conversations early and often with a financial planner, a trust advisor, somewhere where you can protect some of that money, land, if you have a primary vehicle, especially if you have a spouse who may be continuing to live at home and you're looking for some care options, you want to be able to protect some of those resources for them. So I am by no means any kind of legal expert in that category, but there are some great experts out there, elder care attorneys, geriatric planners, financial planners, who can help you kind of navigate that process. So again, a 5-year look back for Medicaid. So it's to prevent people from going out and buying all sorts of brand new cars or having some sort of shopping spree and then having to go apply for Medicaid later on down the road. So how much does all of this cost? I've gone through the different levels of care, kind of some aging options, but want to talk about some resources that are available to you in regards to funds. It's important to know what your assets are and how they can be quickly liquidated in case of an emergency, and to allow you to see how long your money will last. No one really wants to predict life expectancy, but it's something that we have to do in this industry. The reality of the fact is it's expensive to live a long time. So we talked a little bit about insurance, Medicare and supplements, what that covers in regards to doctor's appointments, what you have to pay for your Medicare premiums. One other thing that we do accept here, and most places do as well, is long-term care insurance. And it's something that's purchased through an individual insurance agent. And it can come in all different shapes and forms. It can be riders on life insurance policies. Most popular are probably Genworth. Thrivent has a great policy. John Hancock has some good policies. If you have specifically bought a policy a long time ago, those are the ones that we really like to see in the senior living world, because they typically pay a lot of money and they pay forever. Whereas the new policies will typically have some sort of term limits. They may say you've got $300,000 or 3 years, depending on whichever one comes first. So definitely keep that in mind. If you've got long-term care insurance, pull out that policy, review it, see if anything has changed. Are there riders that you can do to get some additional resources on the back end? So average cost of independent living here in South Carolina, depending on your buy-in process or your monthly service fees, are going to be about $1,500 to $6,000 a month, depending on what kinds of contracts you sign. In assisted living, depending on what level of care you are, because some communities do some levels of care within assisted living so that you can kind of you can purchase a care package for yourself or your loved one, typically between $4,000 to $7,000 a month. Memory care is going to be anywhere from $3,500 to $7,000 a month. Again, I recommend that you research communities, take a look at reviews, find out what these communities have to offer, and go take a look at them before you make any kind of decisions. So memory care can take you up to about $7,000 a month, and skilled nursing is going to run you anywhere from $6,000 to $9,000 a month. And that is, I mean, that's real. We charge $290 a day here in our skilled nursing community, and it continues to be the community that is highly occupied all the time. Skilled nursing beds are hard to find in South Carolina. We don't have a lot of them. No industry leaders are really breaking through and creating any more options for us. It's not a desirable product at this point in time. Most skilled nursing facilities lose money on a yearly basis. So I know here in Columbia and Lexington, we have Lexington Medical Center Extended Care, which is the largest nursing home in North and South Carolina. And they have over 380 beds, and they have been slammed. It's hard to find bed availability. So definitely look into those options before you were to need it. Medicaid contracts I talked about a little bit. We don't have one here at Wellmore, but some places do. Again, for assisted living, it's called OSS. So when you're calling and asking if they have any Medicaid beds for assisted living, reference the OSS program. It's helpful if you've already been approved for the program. Most communities are not going to take a gamble on having a Medicaid pending contract, not knowing how they're going to get paid. When somebody agrees to Medicaid in a community, they are essentially turning over their Social Security check on a monthly basis, minus about $30 a month for haircuts and personal items. But all of their reoccurring income is going to be going to that community. So having that already planned and in place and approved before you start looking for communities would be helpful. I talked a little bit about the Alzheimer's Association. I'm a part of the WALK committee this year. It's going to look a little different this year, but we're still excited about it. They have some great resources available to you, some statistics, some training modules, certified dementia practitioner training programs, some great support groups. They also offer some vouchers for respite care. They offer some grants as well. So it's an application process. Their benefit year starts in July. So if you're interested, those funds should still be available. They do sometimes run out. So since they just re-upped in July, definitely something for you to look into. Same with the Respite Coalition. It provides dollars to prevent caregiver burnout. It allows family members to take a break from caring for their loved ones. And then the VA aid and attendance. If you hear anything that I say in this entire presentation, I want you to specifically focus on this, because this is free money that's available to our veterans and their surviving spouses. I know this is a lot of information on one slide, but there are some requirements for you to get the VA aid and attendance. It is an increased pension program designed to help veterans with costs associated with aging. There are in-home benefits, there's in-facility benefits. Now, this is an increased pension program. So if they're already receiving a pension, you're only going to be able to increase it to the maximum that you see over here on the right-hand side. So long story short, with the eligibility requirements, you have to have served 1 day during an active wartime no less than 90 days of consecutive service. You must not have been dishonorably discharged. So a regular discharge, honorable discharge are all good. You need to have a copy of your DD-214, which is the copy of your discharge paperwork from the military. And if you need to get your hands on a copy of that, your local county VA office can help you get that as well. You have to have a need. You have to have a physical need for some sort of assistance or ADL care. Usually when people admit to an assisted living community, that's a guarantee that they're going to be approved. So there's some paperwork that we have to fill out on our end, but that shows that they do need some assistance. There is a monthly income maximum. You will never see it in print from the VA, but we have been advised to tell people once you get to about $100,000 worth of liquid assets, that's when you should start applying for this benefit. If you apply any earlier, you will be denied. And once you reapply, once you've spent down that money, you'll have to then justify how you've spent those funds. So it's just best to go ahead and wait until you've got about $100,000 worth of liquid assets in order to apply for this program. So that's your net worth maximum, and then your monthly income maximum is about $1,200 a month, which doesn't sound like a whole lot, but you are able to deduct your medical expenses from that. So if I receive $4,000 a month in reoccurring income through stocks, bonds, investments, Social Security, retirement, whatever, but the cost of my assisted living place is $4,500 a month, I then subtract that from my income, and that has put me below that $1,200 a month threshold. If you are a surviving spouse, you must have been married to the veteran until he passed away and never remarried after that. So essentially when your veteran passes away, that benefit will go away if you do decide to get remarried again. If you didn't listen as much in history class like I did, here are your Congress determined war times. And these are the ones that you have to serve one day during an active wartime in order to qualify for this benefit. There are a couple of people who have served, one day during the gap period, but they are hard and fast about making sure that you serve one day during that active wartime. So get a copy of that DD-214 out and start looking at those dates and see if you fall into those categories. Payments, you see the monthly maximums on the sides, about $1,200 a month for a surviving spouse. And then a single veteran is going to be $1,900. Married veteran, if the spouse needs care, so they're married, but only the spouse needs care, it's $1,500 a month. And then a married veteran and the veteran needs care, then it's $2,266 a month. So last things I want to share with you guys are some resources that are available to you. Geri advocates are my favorite people to work with because they work specifically for you as a family. Yes, you have to pay for them. Usually they're nurses. There's some specific companies here in Columbia that do this. But basically they advocate for you. If your loved one lives miles and miles and miles away or across the country, you're not able to manage their bills or their finances or getting them to and from doctor's appointments, these Geri advocates will actually step in and be that almost family-like role for them. You do pay them. They're typically hourly. They're typically expensive, but they really do have your best interest at heart. A Place for Mom is just an example of a referral source that can help you, guide you in the process of looking for a senior living community or for options. In-home care, non-medical home care, all of those things. Instead of paying A Place for Mom, they actually charge the communities that they work with. So they have to have contracts in place. The thing that I would encourage you to remember with A Place for Mom is they don't have contracts with everyone. So if you're looking just in a geographical area, find out who they have contracts with, because they're only going to point and guide you into those directions. There may be some other communities that are not on their radar. I had a specific question about some geriatric physicians and house calls, and there are just not a whole lot of geriatric physicians. It's kind of an unpopular, I guess, category or avenue for doctors these days. And honestly, the shift has really transitioned from these geriatric physicians and MDs to really a nurse practitioner program. There are some doctors groups that have house call options, which means that they actually come to you like concierge medicine, except for it just bills traditional Medicare. So you're not having that big yearly bill like you would concierge medicine. a specific group here in Columbia is SC House Calls, and they will actually come to your house and to provide services for you, and they actually come to our community as well. So there's not a whole lot of options to choose from. I'd recommend reaching out to a neurologist. They can be a great addition to your care team instead of just having a regular geriatric primary care physician. So home health and non-medical home care. Home health is covered by your Medicare benefit, and that's for people who are receiving physical therapy services or need nursing care after a hospital stay or after skilled nursing stay that still have some needs that need to be attended to. Those are going to be places like Fox Rehab, Amedisys Home Health. Those kinds of services are all included with that home health benefit. And then non-medical home care is going to be what you think of as people who come into your home who can clean your house, cook your food, drive you places, do your laundry. They can do a lot of things. There's some things that they can't do, like medication management or administering shots and things like that. But they are a great companion service, and typically you pay for them by the hour. Typically your range is going to be anywhere from $20 to $25 an hour here in the Columbia market. So it can be expensive to hire around the clock home care. But for some people that works for them. Elder care attorneys and financial planners, I'll say it loud and I'll say it again, go talk with them. They have some great resources available to you, can point and guide you in the right direction. Senior Living Guide magazine, I'm gonna hold it up over here so you guys can see. They do these monthly, so they've got some really great resources in it. It's broken down into different tabs and different options. They have a great checklist for like housing considerations. What's important to you? Staying in your present home, living near your friends, feeling secure, knowing that health services are available. So it gets you just really thinking about what those next steps are in a non-threatening type of way. There's also a section about financial consideration, what your expectations are for paying, how much you've got to spend, what average costs are in your area. So definitely a good resource. You can reach out to senior, excuse me, this is all about seniors, not the Senior Living Guide. You can reach out to them directly, or I'll be happy to bring you a copy of, I've got some here in the office as well. One of my favorite programs is called the 5 Wishes program, and it's a little booklet, looks like this. I've also got lots of copies of this as well. You can order them online. In South Carolina, it's recognized as a legal document. And what it is it outlines 5 questions. Who do I want to make care decisions for me when I can't? The kind of medical treatment I want or I don't want, how comfortable I want to be, how I want people to treat me, and what I want my loved ones to know. It even outlines, you know, what songs you want at your funeral, or any specific scriptures, or who you want to be there. If anyone asks how I want to be remembered, please say the following about me. This is an awesome document. I've given it to all my family members for Christmas. I want them to fill it out. If you get it notarized and fill out this back part, the hospital will actually recognize, you can cut out this card and laminate it. The hospital will actually recognize this as actual legal documents here in South Carolina for powers of attorney and living wills. So definitely a great program. And then of course your county offices on aging, every county is going to have some sort of resource available, whether it be senior centers, or Lexington County's got a great office on aging and building a new one that has some great exercise programs and a place where people can gather and spend some time together and play bingo every once in a while. So definitely some good resources that are available to you. All right, here is my contact information. Shoot me an email, find me on Facebook, find me in the USC directory. I'll be happy to answer any questions that you guys have. Let's see if I can get back to some questions. All right. How about memory exercises to help elderly relatives? Recommend simple exercises, stuff that they can follow very easily. So we do a body bingo game, which is a lot of fun, which is going to be, you know, arms up, to the side, simple things that they can follow, cues and simple commands. We've also had really great experience with music and memory care, and it can be really helpful to spark some moments of joy for them, or some things that brought them joy earlier in their lives. And you'd be surprised how many people still want to get up and dance. All right, let's see. How do you recommend finding a good agency to hire, bring help into a private home? The market is saturated with non-medical home care companies. And some of them, just to be quite honest, are glorified babysitters. So I've had families who have had a specific group come in and interview each candidate so that they can find the right fit. The problem with these companies are, if you want 24-hour care, that doesn't mean that one person's going to be with you 24 hours a day, 7 days a week. They're going to have to switch in and out. So finding multiple people that you're comfortable with. There are some home care, non-medical home care companies that are JCO certified, specifically Right at Home here in Columbia, and they've got some franchises all around that can provide you some of that extra sense of security of knowing who's in your home. Oh, so many questions. Okay, I've heard that you should agree when a person. All right, so the question is, I've heard that you should agree when a person with dementia says something, even when what he or she says is incorrect. Do you agree with this? Every person is different, and I'm not going to tell you how to interact with your specific loved one, but there is something that I do support that's called therapeutic fibbing. And instead of having somebody relive guilt or grief over and over again, if their husband passed away and they keep asking for him, saying things like, oh, he's gone for a little while, but he'll be back a little bit later. Some people are not comfortable with that, and it does take some practice. I'm not telling not the truth. It's just the way that I say it. So yes, it's something that I support, but it has to be done very delicately, and it does take some practice. Some people are not comfortable lying to their parents. But if mom keeps asking about dad and I keep telling her that he passed away, she's then reliving that grief and that guilt all over again, multiple times. So just something to be mindful of. All right, my father-in-law is forgetting key relatives for helping as caregivers. Are there any exercises we can do to help him remember those people? I always recommend some sort of photo album with big printed letters on who these people are. And not only do a picture of them now, do a picture of them maybe 10, 15 years ago, because when someone with a cognitive impairment looks in the mirror, they don't see an elderly person. They see themselves as 10, 15, 20 years younger. So I look like my mom. Somebody with dementia might think that I am my mom, just in younger years. So having a photo album with the specific family members, again, big words up at the top of who they are and how they're related. Even a family tree could be really, really helpful. Again, keep those simple tasks for them. Big pictures, big words definitely could be helpful. And come and visit often, and don't make them feel bad if they don't remember who you are. So many times I hear family members walk in and say, oh, mom, dad, you remember such and such from your Sunday school class 25 years ago? They might not necessarily remember that. And that's okay. You just play along with it. You talk about memories together. You talk about fun that you had back in those earlier days. Don't ever make them feel bad for not remembering. They're hard enough on themselves for losing their independence. All right. Specific home care agencies in Columbia you recommend. Again, this is just my recommendations of people that I have worked with. McLeod Home Care, Right at Home is JCO certified. Most places are going to provide 24-hour, 7-day-a-week care. So there's some really, really great options out here, and depending on geographically where you're located, could be helpful for you as well. Let's see. Contact information up again, coming at you. Oh no, now I can't see the chat. Okay. I really should have listened more in my computer science class. All right. Let's see. How does decision-making change when dealing with a married couple versus individuals? Always talk about expectations. You know, do you want to be together in the same apartment forever? Can you afford 2 different levels of care? I love my husband dearly, but we are never going to be able to share a 350 square foot apartment together. So that's my expectation, is that we would need more space. allow them to talk about how they made decisions together prior to cognitive impairment. Who made most of the decisions? Was it mom or dad? Was dad's word the final word? Involve them as much as you can in the process, because at the end of the day, it's their life, and it's the place that they have to be and the joy that they want to have. It's not easy. Having two parents that are elderly and aging is challenging. It can be very expensive, especially when their care needs are different. So if a parent doesn't want to look at assisted living home, how do you recommend changing their mind? I always just encourage them to come out early and often. If a parent doesn't want to look at an assisted living home, use it as an excuse to go out and have lunch. I have people come to my dining room here at Wellmore all the time. It's, we're the new restaurant out in the area, and we don't look like a senior living community. So getting them through the front door is the biggest challenge. Having them come sit down for a cup of coffee, or just to come check out the food, or to visit a friend that maybe that was in their Sunday school class, or an old neighbor, a non-threatening way to get them in the front door. I know when I meet with families, I'm here as just an advisor. I love Wellmore and I want everyone to live here, but this isn't always the right fit for everybody. So find an advocate who will inform you and educate you and arm you with all the information that you need to make an educated decision for if and when the time does come. Explain again, please, the financial commitment required for new residents, a 90% contract, liens on your home by the retirement community. Don't understand the purpose. That's a long-winded process. Cindy, I'm gonna reach out to you specifically so that I can address those with you. There's different types of contracts for CCRCs. It is truly a real estate transaction and an investment. It's a way to tie up your funds for your family moving forward. If I sign a 90% contract at $600,000, that means that my family is going to get 90% of my $600,000 when I move out. But because I signed a 90% contract and this community is not going to be able to keep those funds, I may have a significantly higher monthly service fee each month because I signed a 90% contract. There are communities that will help you sell your home and actually use some of that equity ahead of time so that you can get into communities faster and you can sell your home when you're not there. So there's a lot that goes into those. I'm happy to reach out to you directly though, because that's a whole nother conversation. All right, there are a couple other questions. I'm going to reach out to you guys directly because I know we're running out of time. As you can tell, I really enjoy talking about senior living and what it has to offer. So if you have any questions, do feel free to reach out to me. I'm happy to continue the conversation.
Great. Thank you so much, Jennifer, for your time and knowledge. I know this was so much information packed into an hour, so we really appreciate you being here. And thank you to those of you who logged on today. I hope you got some great takeaways from today's event. The recording for the event will be sent out within the next 2 days with the survey email, so be on the lookout for that. You can always see our event recordings on our YouTube page as well. Thank y'all for joining us, and thank you again, Jennifer.
Bye.
Bye.